Good evening. NHS maternity services in East Kent got worse, not better, in the weeks after an independent inquiry said at least 45 babies had died unnecessarily at the William Harvey Hospital in Ashford and the QEQM in Margate.
Things got so bad that the health watchdog, the Care Quality Commission, considered closing down one of the units. Inspectors were sent in unannounced by the CQC in January, and in a report released today said there were serious concerns for the safety of mothers and babies.
At the William Harvey, it said staff did not always clean their hands or use PPE, such as gloves and aprons, in between patients.
Vital equipment, including resuscitation units, were not always working properly or in the right place, potentially delaying treatment for newborns.
Both services have now been downgraded from requires improvement to inadequate. So what is being done to restore confidence for families and mums-to-be? Here's Joe Caution.
Families have spent more than a decade pleading for changes in maternity care at East Kent Hospital's Trust. Changes that were promised back in October, when Dr Bill Kirkup's inquiry concluded 45 babies should have lived if they'd received adequate care. Tanya Linehan's son Ashton was one of them. He was stillborn at the William Harvey Hospital in Ashford in 2012.
It's the worst experience you can imagine, to go all that time. You have absolutely everything ready. There was people that you encounter. You're not necessarily close friends with them, they're neighbours, they're people that see you in the supermarket and they say, "Where's the baby?" And you have to go through it over and over. I had spent days asking them to help me. I wasn't helped, and then I ended up with no baby.
But in January, just weeks after the Kirkup review was published, inspectors found maternity care had deteriorated further, to the point they considered shutting down the unit at the William Harvey over safety concerns.
And we have had so many assurances for so many years that things were getting better.
Helen Gittos lost her baby Harriet 8 days after being born at Margate's Queen Elizabeth the Queen Mother Hospital in 2014.
There was so much scrutiny of the trust that women could be assured that they would have safe care. That wasn't true. And behind these reports are people's lives. And it's really important to understand that this is not just about babies who are not here. These are about families who are dealing with caring for very disabled children and who have not been given support by the trust to be able to do that.
Days later, the Trust promised to make immediate improvements, and as such, the CQC decided on weekly monitoring of the service instead of closing it. The inspection laid bare multiple instances of inadequate practice. At the William Harvey Hospital, inspectors found staff did not always ensure a second opinion was sought. The triage and daycare facilities were poor, and women were cared for in a chaotic environment. Meanwhile, at the QEQM Hospital, equality and diversity were not always promoted within the service.
We've got to remember that the majority of women who attend this trust will still be able to receive safe care, and we've got to consider the impact on the local population if we were to take more serious action.
The Trust Chief Executive has apologised and says staff are determined to improve services for patients. But back in Dymchurch, there's a lack of faith that all staff at the Trust truly grasp the scale of change required.
We need a real demonstration from the Trust that things are changing, and it's been targeted at 3 years. That's too long. We need some real simple changes. Mothers feeling believed in, and when they walk away say, "That was a fantastic experience," not "Wow, I got away with it."
Well, let's cross live to Joe Caution at the William Harvey Hospital in Ashford. Joe, why were changes, not even simple ones or easy ones, not made immediately?
Well, that's the burning question, Matt, that families in East Kent are asking tonight. NHS England has had in place what they call maternity improvement advisors supporting the Trust since 2019. Family want to know, frankly, what they've been improving for the last 4 years. Now, of course, this inspection was back in January, and the Trust tell us they have made significant improvements since then. And as the CQC alluded to in my report there, they've been under close monitoring ever since and will continue to be, and hope that offers some reassurance to families watching tonight that it is safe to give birth here.
Joe, where does that, though, leave families?
Well, that's it, Matt. It leaves them with more fighting to do, something they've been doing for over 10 years now to try to achieve better maternity care in East Kent. It also leaves them with little to no faith with the structures in place. Helen Gittos tells me that what they've been doing is not working and something needs to be done differently. They tell me, families, that the Kirkup review, which found 45 babies died unnecessarily, should have been the watershed moment. It should have been the catalyst for change among all staff working in maternity here. If that wasn't it, if this inspection report isn't it, what on earth will be?
OK, Joe Caution, thank you.